timing.
Do they charge for that?
No, sir. No, it's they're only CSR activities from DigiShield.
Then I can take the help also for my.
Yes, definitely, sir. Definitely, there are no charges for this also.
Sir, we have already conducted almost 580 plus webinars across the India. So we are supporting all the IMAs, Maharashtra branch, IMA local branch, pediatric, then ophthalmology society. Various associations are associated with us, sir.
You are basically based upon which place?
Our head office is in Pune, and we have local offices in Pune and Mumbai.
Okay, Dipen. What I will be doing very soon, I will be enrolling you for we can't just put a burden on one establishment. So your DigiShield will be made very popular. I've got many things in my mind. In the coming days and coming months, we will be utilizing your platform for many academic and cultural activities as well. With a function, we will be doing that.
Okay, sir.
Today, courtesy Dr. Sachin, we got introduced to you. So we will be enrolling you on our platforms also.
Okay, sir.
Yeah.
Sure.
We'll share his number also, sir, with you.
Yeah, sure. Thank you, sir.
Dipen, please put on our flyer so I can introduce, sir.
You can start, sir.
Yes, sir. Thank you, Dipen. Good evening, all. This is our case meet 26, and for this evening, we have got very big name from our ISA National ISA Society from India, Dr. Sukhvinder Singh Bajwa, sir. Everybody knows him very well. Sir is a professor and head of department.
You are muted, Sachin. You are muted.
Hello.
Yeah.
So, yes, sir is a professor and head of Anaesthesia Intensive Care Department at Gyan Sagar Medical College and Hospital, Banur, Patiala, Punjab. Sir is a very experienced person we got this evening. He did 14 years of editing and reviewing experience and research methodology, obstetric and neuroanesthesia, vast experience in emergency medicine, ex-board director for postgraduate studies at Baba Farid University of Health Sciences, Punjab. Postgraduate examiner since 2016. Sir got so many awards and even publications as most of the one of the best thing and very much great achievement that academic appreciation from Sir R.D. Miller in 2003. 8 books, chapters, including Anesthesia for Endocrine Surgery in Lee's synopsis. Anesthesia, 400 plus national and international publications are done by Sir. Even authorized 7 national guidelines in anesthesia, medicine, and endocrinology. Editor-in-chief of Northern Supplement of IGA. Even Sir, associate editor in chief of IGA, associate editor in chief of JOSCP, EB member of 13 plus international and national journals, ex-honorary secretary of Punjab State ISA, ex-national governing council member of ISA 2018 to 2021, 5 national awards including KPR Best Young Anesthesiologist of India 2012, Best Research Paper Indian Journal of Urology in 2013, ISA President Appreciation Award for starting Northern Supplement of ISA, IJA, and for developing research methodology model. One of the great person came on our platform, sir, and on this evening. Really, I'm very much thankful to you for coming on our platform. Thank you, sir. Please start, sir.
Thank you, Sachin. It's a very nice and over generous introduction. Actually, whatever I gave to you as my profile, you read everything. Just anyway, thanks. I think first of all, my heartfelt thanks to all the Nanded City branch members, especially our president, Dr. Prahlad Kotkar, and Dr. Sachin, who is the secretary, and all the executive members, as well as all the team members of Nanded City branch. And first of all, I will want to congratulate the city branch because I was having a discussion with Dr. Sachin. They are doing a wonderful job having the case meets every week. It's a very difficult to organize a academic meet, and during our discussion, it came out that most of the anesthesiologists in Nanded city branch are practitioners, and that's a something feather in the cap. There's something the your practitioners holding. Majority of the practitioners holding academic meet is something to you feel revel in the academic superiority. That's why the topic chosen today is almost on the same lines about the practitioners. I've got a very soft corner for the practitioners because I did practice myself also for 3 to 4 years and still do sometime in between because in spite of being an academician, the practitioners in India, they're doing a wonderful job. But just like a director of a Hindi Bollywood movie, he's in the background. All the acclaim goes to the hero and the heroine, and the director always remain background. So that's why how the roles of practitioners into the anesthesia streams is like that only. My sole purpose at this moment and my vision is that the practitioner should be enrolled into the mainstream of ISA because without their cooperation, without their participation, ISA can never progress at a momentum or a speed which it can easily. So today the topic will be that it will be maybe I would have wanted it interactive by going personally to Nanded and then delivering a talk there in front of everybody. But considering all the constraints and limitations, I will be doing it on online. So we will have a discussions and a chat later on after the talk. Let me start first. What is the more important topic today? Sachin, just guide me whether everything is visible on the full screen or not. Is it available on full screen? Dr. Sachin?
Sir, not yet. Please.
Okay, let me do one thing. Just give me one half minute only.
Yes, yes.
Now it's fine?
Yes, sir. Yes, sir. It's
Thank
fine.
you. Thank you, Dr. Sachin. So nice of you.
Yes, sir. Thank you. Thank you.
So it's not a talk. Actually, it's more of would have been an interactive session. Considering the private practice, this entire talk is interwoven around those factors which we should aim that the practitioner should come into the mainstream. So what are the challenges in anesthesia in private practice and how to bridge the academic gaps? That's a very important topic. So I will start with the thing. A majority of you may or may not know about the Maslow's hierarchy of needs. This is a very basic structure, a ladder pattern, which was described by Maslow. He was a very good psychologist at that time of the USA. How we define that physiological needs? If we want to, in this life, the first of basic needs for everyone is physiological needs like air, water, food, shelter, sleep, clothing, and reproduction. Uh, Considering this factor in India, if you really ask me, you may recount the scenes of some big Bollywood hero running over the sleeping people on the footpath. So shelter is not there. Food, many people may not be affording that in India because it is still a developing country. It has not got to the developed state. So the physiological needs are the first needs which these are the basic human needs which everybody should be having. The right to air, water, food, shelter. I think these are not covered under the fundamental rights, but these are physiological needs. And talking about the anesthesiologist, we will be focusing this step ladder pattern on our profession. So majority of us, we do cross this ladder, the physiological needs. Then come out the safety need, the next pattern. If you fulfill these needs, then that's the personal security, the employment, resources, health, and property. This is where majority of our professional colleagues and fraternity is aiming at. And right from the day of passing the PG, examination about the personal security and where to get the employment and maybe private practice or maybe the government institution and how to get all the health policies and maintaining the health and how much property they should buy considering their future life and career. When these safety needs are met, I think majority of us also cross this ladder also. Then come the next ladder pattern is the love and belonging. Here we do go with all these whatever the virtual abstract, these are criteria like friendship, intimacy, family, sense of connection. Here's in sense of connection, I will like to emphasize on ISA. We are a part of ISA. Everywhere we always have, almost after fulfilling the basic needs, we belong to this ladder. And sense of connection means you may have got a good city connection in the friendship, right from the school friends, then from the family connections. But the sense of connection at a national platform is mainly through ISA. Okay, once you cross this ladder, or once you cross a particular stage of your career, you jump to the one of the highest ladder, that is esteem, self-esteem, where you want to earn respect, where you should know, where you feel that I should have respect, the self-esteem is there, it is bubbling inside you. You think about your status, whether you're a practitioner or you're academician, you think about the status. You want to get recognized in your own circle, in your city, state, at a national platform, or in the family, wherever. The recognition pattern is very important because what have you done in your life? What have you achieved with your hard work? You always want to get recognized. Then the strength and the freedom, how much power you really have in your present status and how much freedom you have to express yourself in society. That is self-esteem. Many of us basically achieve this ladder pattern almost after a few years of our post-graduation. Then is self-actualization. This is the topmost, step in the ladder pattern of any professional. We are talking about the professional here, not about the spiritual saints. Many saints are there, like Sadhguru and all those people who may have, come to a stage where they know what they have to do in life, how to go for the self-actualization, that desire to become the most that one can be. In our practice, in our anesthesiologist, if you ask me honestly, this stage was achieved by majority of our anesthesiologists during COVID times. We were the frontline warriors. And that time, while doing, especially the PG students, I have a good, very generous heart toward them. Whatever the duties they did, because the seniors beyond 60 years or beyond 50 years, they hardly entered the ICUs. So at that time, many people realized that what they were born for, they did the duties with a full heart. And that was a self-actualization stage. They knew what they are achieving, the sense of satisfaction, the sense of achievement. This state is rarely achieved and only achieved only when the person becomes very much, almost crosses every ladder. And then they realize what they have come into life this for. Many anesthesiologists have achieved this state. Our very super seniors, our gurus, they have achieved this state, and they are doing, who are producing more of anesthesiologists, the more of students, whether in academic institutions or even into private practice, who are the mentors. So this is a Maslow's hierarchy of needs. Our entire profession, entire medical fraternity can be extrapolated from this hierarchy of needs. Now coming to our main topic, what are the challenges and limitations of anesthesia private practice? This is very important and many people will be agreeing with me. The first point, insecurity. In private practice, we always have insecurity, isn't it? whether you are a seasoned practitioner or practicing for a long time, that insecurity as compared to the government job is always there. This feeling never dies down. Maybe it may fade to a lower extent, may come to a lower degree, but this is the biggest feeling and the biggest challenge in the life of a practitioner, and only a practitioner can understand this insecurity. And always there is they are always alone and no helping hand. Many times complications comes during the operation theater or even ICU if they're handling it. And they're handling it alone without the help of anybody who can help them at that particular time. So this is remarkable. They are handling it. In institution, you will have a team, but in practice, everybody is handling it alone. There's no fixed salary. Mind it, I'm not talking about the institutions or the corporates. I'm talking about the practice who are freelance or a fixed lance or day-to-day practitioners. They have to work. They have to work every day to earn something. Okay, they may be earning a bit higher as compared to the counterparts in the academics or the corporates, but they have to work every day. There is no fixed salary. The more you work, the more you get. The less you work, the less you get. And there's a minimal time to prepare the patient. This is very important for a practitioner who are doing the practice. You don't get much time because of the cases, number of cases you handle per day in your practice. And sometimes you get inadequate investigations, which again hamper your decision making. That's hardly you get a time for optimization. A patient coming to you in emergency, you have to take it like a challenging task. You have to take it. Optimization time, you may try to optimize, but the time is very limited. And so you cannot refuse that case. Refusal of a case difficult task. So you are doing a practice in a hospital or a nursing home for a long time. Suddenly a case comes, become difficult for you to refuse a case on the grounds of these type of complications. And planning of family affairs is a difficult task. I'm thinking like a practitioner now. Don't think me I'm a editor of a journal or something like that. I'm an anesthesiologist basically. Every anesthesiologist first before they are a editor or academician or a practitioner. Like anesthesiologist, in practice, it's very difficult to plan a family affair because the kids may have exams at different times. The kids may have their different routines. Your spouse may have a different routine, and you having a different routine. Very difficult to plan a task. And if you plan a task, if you want to go to some vacation or somewhere to the hills or enjoy somewhere the foreign country, duties adjustment become very problem. You have to replace yourself in the hospital where you're working with somebody who is equivalently good and can help you in performance of the duties the way you are doing. And above all, there is no fixed holiday. For a practitioner, Sunday is also working day. Practitioner, this one, gazetted holiday is a working day. A festival is a working day, whether it's a Diwali or a Holi or a Dussehra or a Christmas. Every festival is a working day for the practitioner. Yeah, for academicians also you can say it's a working day, but they always have a person to depute on duty on those particular days. Challenges doesn't end here. There are some more challenges. Many times when you, I think, the starting a practice or even you are doing a practice for a long time, you still are encountered with some ill-equipped operation theaters where you don't have a complete equipment for resuscitation. Then there may suboptimal atmospheres and the resources, including manpower, is less. You may not be having that adequate and trained manpower to help you in the difficult times or during the course of complications. Then there is a higher vulnerability to medico-legal issues. You are alone. Nobody is there with you. In institutions, there is always somebody to help you. Sometimes ego clashes with colleagues and surgeons. I think this can happen early in the days when you start a practice. When you are new from an institution, you have come from an institution with a different type of teachings, and you don't know how to compromise between the situations. You don't know how to do the communication properly between the surgeon and the patient and the society. At that time, this is common. Otherwise, in the later stages, these reduces to a minimal level. And above all, I will say that how much hard work you do in your life, in you as an anesthesiologist, a practitioner, You are recognized to a local area. I'm saying ISA Nanded branch. So many practitioners are there. How many of them are known to the state level or to the zonal or to national level? Because this recognition is confined to a city. And every human being, they think that when they do a good work, they should be recognized. A recognition should be bestowed onto them. They should be given encouragement for whatever good work they are doing. So this is another challenge for them. And many times, if everybody agree with me, this is a fact. Many a time you are at the mercy of whims of a surgeon, especially when you are new to your field in a practice. Sometimes, every human being is not same. People are different. People are different capabilities, different psychology, different intellect. So behavioral problems can arise, marital discord can occur, and substance abuse is common. If you want a survey, in the surveys of the British, the Royal College of Association of Anesthesiologists, you will find this. There's a maximum substance abuse and suicide among anesthesiologists, among our medical fraternity. So these are common among the way that we are performing our duties, especially the night call, which is the most stressful. Night call, your phone is nearby your this pillow, and whenever it strikes a bell, your ear gets erect, and you just see your the sleep get disturbed, and if it's a call from your nursing home or you're from your hospital, it will be very disturbing. And in space of that, how can you say that we do publication? I agree with you people. No time for publication, and there's a lack of motivation for academic work. Who will motivate you? Who will help you in publication? Because these are not a simple thing, and also there are less academic opportunities for you. Many times you don't find the people from a private practitioner sect attending a conference. Those few are there who have got some connections. They want that register. They get some lecture. They get some opportunity as a chairperson. But many at times they don't get opportunities. This is a limitation as well as challenge. Now, phase of private practice. Suppose I am a passing out from an institution. I want to do private practice. I don't want to go to the institution to do a senior residency or a job in a corporate hospital. That phase is a struggling phase. You struggle. You go to the different hospitals asking for work. You go to different centers like radiology center where sedation can be given for MRIs or CTs that the patient needs to be sedated, or you go to the different ICUs to get something. Some locum duties also you can do. But during this phase, you struggle a lot. This is a very important part. And this phase makes you a much better person, if you ask me honestly. Then is there a golden phase. Once you overcome this phase, you do sincerely, very honestly, skillfully. You got a reputation at such a level that people say this is the person, this is the anesthesiologist who cares about the patient, who cares about the medical science, who cares about the procedures, who is dedicated towards whatever you can say toward his duties. At that phase, even the surgeon will wait for you. He will wait that you get free time, you come for to me, I will get this case done only with you. And this is where that golden phase makes your reputation. I think 15 to 20% is a very arbitrary term, are enjoying this golden phase in India. Then is a master phase. This is a phase, just like a ladder pattern, Maslow's need hierarchy. The self-regulation is the topmost ladder. The master phase is also the topmost ladder in the private practice phase. Here, those practitioners which have done wonderfully in the golden phase, they must have, made such savings or something investments where they feel secure. Here, if they want to do night calls, they just want to see that somebody else get opportunity, a younger person They will collaborate with the younger person and other colleagues. So they will be helping each other. So this is the master phase. You become so good that the life needs are met. Now the time to rejoice and time to be free from all these type of medical hectic activities so that you can give a work-life balance. Now, important question is comparison with the academic scenario. First of all, I will say in academic scenario, in the academic institution, they have a fixed time, say 8 to 5. It's a fixed time. They have to work from 8 to 5. I'm talking not about a senior resident. I'm talking about the senior residency onward from AP to professor level. They have a fixed time from 8 to 5 or 9 to 4, something like that. Hierarchy is there, right? From the PG resident or junior resident to the professor and head. There's a hierarchy level going on. And there is a fixed salary. And you get a regular increments in the pay every year. You get another good this incentive is the residential quarters. Many places they're providing free accommodation to stay in the campus. Then you get a vacations to enjoy. How many times practitioners enjoy the vacation? Hardly. Maximum 1 week or 2 weeks, even if they go to foreign lands. When again I told you adjustment duty is a very big problem. And then the resources are optimal institutions and team is invariably there. As compared to the practitioner, they are always alone. And immune cover of the institution or the hospital. This type of whatever bad goes, whatever the complication goes, especially in the present scenario where the violent behavior of the patient relative is very much on the rise. You know, this is something. As anesthesiologist, surgeon, we work as a team with as a medical fraternity. We are always facing such challenges. And then there is a good bag of academics for the people who are working in the institution. So all these factors, they are somehow missing in the private practice. But still, I can say there are advantages of private practice, and many of you should agree with me on this front. You are own boss. You are one's own boss, and no need of following hierarchy system many a times. You know, it's a little bit, something not relevant to say, but a boss is a boss. There are two rules in the life. First rule is boss is always right. The rule number two is if ever in doubt, go to rule number one. So that is a rule we are following in our Indian setup. So in this private practice, when you are doing your own work, your own boss, you are not seeing the, getting a bad word from the boss, what you have to do, or you have done something wrong, something like that. Because you are your own boss, you know how to do the correct thing. And that's very important. There's a flexibility in work time. You don't have to work fixed timing from 9 to 5 or 4, 8 to 9, 4, something, whatever it is. You can always have a flexibility in work timings, wherever their timings are thing. The best part is between these timings, you can do your daily course of the whatever you can, the banking thing, the other things, important things of the household. You can always get those things done during this timing when you're free. And this is very important. You may have thought about it or not. But if I want a practitioner, I have a choice of hospital or a nursing home. I want to join this hospital. I want to choose this nursing home as my own, rather than working in that particular institution where the hierarchy system is like that. You work like a almost, a bonded labor type. So you have a choice here. And more important is choice of a surgeon. This is very important because many times we feel that this surgeon is very slow. This surgeon is not that good in surgical skills. Why should I work with this surgeon? So you have a choice to choose a surgeon of your own. The way you choose your nursing and home or a hospital. And there's a more autonomy in professional decision. This is very important. This is here the intellect, the brain, the mental aptitude of a professional practitioner goes because they have autonomy. Nobody is going to disturb your decisions here. And habit of self-work and enhanced confidence. Yes. I've seen in these institutions, once you go ascend to the hierarchy, I think from AP onwards, this dogged work level, your everyday work level decreases. You're more of a become a supervisory. But in private practice, everything you're doing yourself. That gives you the self-confidence. The way you're doing it, I don't think so in the academic institution can follow the same practical pattern. Whatever you're doing, you're gaining an experience, you're gaining. I'm just take a case of spinal anesthesia. The way you give spinal anesthesia and the way person, a senior person of a institution gives a spinal anesthesia, you can be similar depending on the work efficiency of the person institution. But whatever you will be doing, majority time you do in the first break without giving local, which is not recommended actually. But this is what is happening. The practice you do makes you a more self-compliant person with enhanced confidence that is somehow missing in majority of the people working under the supervision. Financial worry. I put a question mark. Is advantage or a disadvantage? I will say it's advantage. Because the more you work, the more you get. If you are already in the habit of self-work, the more finance you will get. And this is what? You start earning finances right from the day you pass out. So by the time your needs come, that financial crunch, that financial, emergency come or exigency come, you have a financial, what you call, background. You have got a financial backup to help your all the causes which are going to cause worry for you. This is very important point. This is where nowadays the new workshops are coming up, the communication skills in anesthesia, whether it's operation theater or it's intensive care units. The interpersonal relations become very good when you're a practitioner. You're not in any type of ego or a high self-esteem or something like that. Just like you see nowadays in the government offices, the way you explain to the patients, the way you explain to the patient, whether in ICUs or you in the operation theater, taking a high-risk case, that explanation, that interact with the patient relative, consisting of both of empathy and sympathy, it doesn't come easily, and it is not taught into your postgraduate career, or it's not there in the curriculum also. This you gain when you are interacting with the relatives of the patients personally. And that's where I think the practitioner scores over the academicians. Academicians may be good. They may be very good in counseling, sometimes better than the practitioners. But we are talking about a bulk here. Almost every practitioner has to have a good communication skill to survive in the practice. That is what I call the acquisition of communication skill is much, much better, much easier, smoother in the practitioner as compared to the academic atmosphere. But now we are coming to the important part, the doubts and queries of the practitioners when it comes to a state, zonal or national scene. They will say, we are not interested in lectures. They are hardly practical so as to be useful for daily work. I agree with this. Because the majority of the lectures, when they are chosen, now being a editor of a journal, of a national journal, which has got, such a good ranking in the international arena, I still say those lectures, who conceived them? How are they conceived? What is the novelty? What is the practicality on those lectures? I congratulate here the Nanded branch for developing this program, especially the president and the secretary and executive members, because the case meets, it is the need of the hour, actually, which I will be discussing in the coming slides. So the practicality of the lecture is very important. When you choose those lectures, there should be some logic behind it. It should be, attracting the crowd. It should be attracting the people rather than just half of the people yawning, sleeping, thinking of their own personal daily life during a lecture, what happened to them in the morning, what was they doing, what they are going to do. Majority of them, this thing happened during a lecture. Whether it really attracts them to the lecture, whether it's really practical for them, that the things being discussed in this lecture are applicable for them in their daily practice. That's very important. And I agree with them totally here. Then why waste money and time? There are many places where the practitioners or the academicians also have to apply to renew their registration from the council by getting credit hours. So they will say, why waste money and time when one can easily get credit hours displayed on the certificate by simply the registration? You say, I don't know how much credit hours the Nanded City branch gives for this meet, but even I think the holding such meet is a good thing. But I will request the president and the secretary that try to give the credit hours if they are not given. If they are given, it's okay. Not given, try to get credit hours from the Maharashtra State Council in the coming days, so that whenever the practitioners or whosoever attends these lectures online, they should mark their presence. There should be a facility so that the credit hours should be given to them, and that can be taken off if the Maharashtra State Council requires those credit hours for the renew the registration. And this is a very valid point. They say we sacrifice our practice and rather spend money for attending such events, isn't it? On one side, you are leaving the practice, you are leaving your daily money. You are suppose I say there's a Maharashtra State Conference going to one of the YuvaCon is going to held in Nasik. Many of the people from Nanded going to Nasik for attending that event. What will they do? 2 days gone, their ICU duties, their operation theater cases, they have to give to somebody. Rather, whatever they would be earning, they have to give to the other person. So they have to sacrifice their practice and spend money. And even there also they have to do registration, accommodation, and other charges also, traveling charges also. So this is like a spending money. Spending money for what? What are the gaining in that attending that conference? This is a pertinent question. I will be answering that in the coming slide. On the other hand, academicians get leave and their registration many times is paid for these type of conferences by the institutions. Institution they give, many institutions they have a policy that the registration money is reimbursed or the traveling allowance is reimbursed. And then the practitioner will say we are at loss actually. There is no agency, and every time a practitioner cannot tell the companies to sponsor them. Consider the COVID time. The companies hardly sponsor those academic events. How can you ask the money from them? No, it's not easy. So it's a loss actually if they feel like that. And is this CME or conference going to improve our status? A practitioner will challenge this thing. Is this simple CME or conference is going to improve our status? This answer I will give right here now. Even in the research academics, if you ask me honestly, even the research academics, a single thesis research, if you publish it, is it not going to change the course of the medical science? It is always the accumulation of small researches which will help in the change of medical science. बूंद बूंद से सागर बनता है. एक CME कॉन्फ्रेंस आपका जीवन सफल नहीं करेगी, जीवन में चेंज नहीं लेकर आएगी. It's always a boon or a continuous regularly attending the CME conferences where you will get advantages of such things. फिर a question आता है, academics are not my cup of tea. Okay, true, not cup of tea. Then why we have come into this profession? Just to practice, just to earn money. We can earn in a many simple ways without coming into this profession. Because this is a medical profession. And we are not doing justice if we are not well versed with the advancements in our specialty. We are not well versed with the skillful procedures which are happening every day. So academics not my cup of tea is not a valid answer to this thing. If we want to be a practitioner, then there's a very fine line between a practitioner and a technician. Your knowledge veins because the medical knowledge decreases to some extent after some time. The technician is there. He may get knowledge, he may get experience with the time. So why we should be at par with the technician? He may not be well versed in the complication, how to handle complication, but the skills, the procedures, those are not only thing for what we are made for. We are made for to know the details of the medical sciences advancements. And inferiority complex. This is a very common thing. Few of our practitioners are afraid that they do not have that much theoretical knowledge as compared to institutional person. So they do not feel like interacting during these conferences. किसी कॉन्फ्रेंस में जाते हो, कहीं कहीं घूमने चले जाओ, ये चले जाओ, आउटिंग कर लो, बैंक्वेट अटेंड कर लो, वो कर लो. But during a session, when you interact with the academicians, I'm telling you, whatever simple doubts you may have, you ask it. It will give a self-confidence to you. You have something in between. You have something in you that is going to be answered by the people. You have such a vast experience. I may be handling a difficult case in a resource challenge circumstances. I will put up my question like that. In that circumstances, what will you do? You don't have a time to shift a patient to a higher center. How will you save a patient in that particular circumstance? So you can always ask this question. So interaction is not a big thing. So finally, a good doctor or a good anesthesiologist, to be successful in anesthesiology, or I will say in the medical sciences, one must excel academically. This is the first point. Whether you are a practitioner or academician, you have to excel academically to be successful in anesthesiology, because this is a very dynamic branch, changing every day, bringing new advancements, and you have to be updated every time. So, and you have to be incredibly detail oriented with every procedure, skillful at procedures. This I agree. Whatever the procedure the practitioners are performing, they're doing it their own. They're very skillful in that. And calm in stressful situations. And I always give higher marks to practitioners as compared to academicians in this type of atmosphere, because the complications, whenever occur, when they are alone, they handle it much better. It's a fact. And they are warm and caring to ease the patient anxiety. This is the thing which is lacking in majority. When majority of the thing that the patient is of surgeon, what we have to do? Let him or her consult the patient? No. I have always stressed upon the post-operative anesthesia rounds. This is a very important. When you want to get recognized as an anesthesiologist, as a physician in the eyes of the society, give post-operative round. I'm telling you, they see your face, they will say, this was a doctor who visited us during the post-operative round, and he's the real person who really took care of us. And that's where you score your branch. That's where you score for your branch and for yourself. So scope of growth is always there. When you are in the beginning, you visit all the medical and diagnostic center where you can do practice, you do the duties in ICU. So that is the scope of growth. When you pass out anesthesiology, I'm talking this for especially the postgraduates who want to do the private practice after just passing out without doing the senior residency. You have a lot of options. You can go to any medical center, any nursing home, any hospital, any diagnostic center. You will have opportunity for that. Or you can work with the senior anesthesiologist also. This is sometimes give you, they can give you guiding light, how to go about in life and profession like that. Nowadays, this is a trend. Anesthesia groups. One of the group I just interacted in the last Friday at Hyderabad with the Exxon group, one of the founder person of that group, and how they are managing that group. They almost have 175 people in that group, and all the people, they are members of ISA. That's a very heartwarming thing. They are maintaining, a very exemplary thing. You cannot enter that group unless you are a member of ISA, a life member of ISA, a permanent life member of ISA. And growth should be holistic. It should cover your income. It should give you respect and recognition and academy. A practitioner without academic cannot grow holistically. You may grow wealthy, you may have many cars or bungalows, but holistic growth comes with academics. ये पल्ले बांधने वाली बात है सबके लिए. So for constant growth in academic life or in your professional life, you have to always have honesty and loyalty towards your profession, towards your patients, towards your surgeons, or towards your institutions. Regular updation of knowledge and advancements. That's what I meant in that during that particular line about the CME and conferences. एक CME conferences आपका status नहीं बदलेगी, but a regular updation of knowledge and advancement during CME and conferences can definitely help you in shaping your career and helping you growing holistically. Always learn through workshops. There are so many workshops. I think nowadays it's very easy. You want to get some knowledge, you want to have some skill exercise. The workshops are always there. You just have to take participation in that. So short courses and fellowships, many of them have been started. In ISA also, we have started many courses and fellowships. We are going to have a skill center. That program is almost in making, where we will be having a tie-up with one of the best skill centers of the country, where you can enroll and where you can get good skills for a particular time, and then you can enhance your career growth. And this line is meant for everybody who was practicing anesthesia. Try not to gain work by hook or crook, but by one's own capability and hard work. Respect your fraternity for that. Respect your colleagues for that. Don't play any mischief. And integrity towards one's anesthesia colleagues is very important. The more friendliness towards your colleagues will enhance your unity, will help the branch growth, will help your practitioner ethics also grows. In any city, if you have good relationship, good unity among your persons, it will help the complete growth of your profession. Nowadays, many anesthesiologists, they are establishing their own centers. They are calling surgeons for the surgeries, and I think that is a wonderful idea. Many of my known people, they are doing that, and I think that's a good one, because you are the best person. You are a good administrator. You are a good physician, and you can always coordinate between different people. And I think it's worth. If you have an income, if you have got that much money to establish a center, you can go for it. Now about the relative value guide, it is being practiced in US, Australia, New Zealand, South Africa. Relative value guide means about the practitioner. This has been covered by I will not lament much upon that, because it has already been uploaded on the website of ISA about the private practitioner forum. And your remuneration should be dependent upon the time that you devote to the surgery, the complexity of the surgery, the risk profile of the patient. This is very much, there. But this has to be taken care by the city branch or the state branch. So what are after the end of lecture, what are the possible solutions and room of improvement for our practitioners? एक practitioner बोलता है, मैंने 20 साल से practice कर रहा हूँ, मैं बहुत practice अच्छी मेरी अच्छी है, and I have a lot of experience. The question here is practical knowledge sufficient enough? No. Without the solid academic evidence, without the solid, statistical evidence, that knowledge pertains to you. मैं कहता हूँ आपका knowledge है. You may have developed a procedure. You may have developed some technique over the last 20 years. But what's the use of that? It's limited to you. You disseminate it. You publish it. You write about it. You publish it. I'm telling you, that will help. Not recognition of yourself, but it will help the fraternity also. So practical knowledge limited to oneself is not sufficient enough. You should disseminate it. Develop a habit of regular reading, because regular reading, at least what I suggest everybody is kindly go through all the issues of IJ. It's a monthly issue. The supplements are also coming out, and we are doing such a hard work at the editorial level that we feel that every practitioner should be reading those journals. And very soon, we are going to take out a practitioner supplement. I will be inviting almost all the practitioners to contribute on that, because after such a academic growth in the journal with the ranking, improved ranking, and the impact factor, we are going to invite a practitioner supplement. We are in the pipeline of thinking that how to go about it. So every contributor will be a practitioner, and it will be covering all the letters to editor and case reports about all the difficult cases they have managed throughout their life or throughout their career. Then ISA directory is there. The purpose of this directory is the uploading of data. ISA directory is available on your ISA app. Whether you're having Apple phone or Android phone, you download this app, and any difficult case you can always upload. The data will be confidential, your name and nothing will be revealed, but it will help ISA in formulating policies, in formulating decisions in the coming years. This is very important, and I'm going to advocate for this thing. The data is very much less, especially from the practitioner side, because major time they will see why to upload this. क्या नीड है, क्या करना है इससे, फालतू में क्यों करना है. बट आपका एक सक्सेसफुल केस, व्हाट अ डिफिकल्ट केस यू मैनेज with the limited resources, with the limited manpower, that is going to set examples. That is going to give, a path to find the solution for such problem for the other practitioners, for other academicians as well. So the uploading of data is very important. Publications in journal. I will inform you that in the last 2.5 years of my career in IJA as Associate Editor-in-Chief, the 5% of the publications are from the practitioners. We are encouraging, and they are doing equally well in revising, in uploading, and few times the thing get rejected because the practitioners don't go to those things whether this has been published before or not. They keep on submitting, but the submission rate is much, much higher now. And we are feeling very glad that the practitioners are publishing in Indian Journal of Anesthesia. That's something to cheer about. And also, as many subspecialties of anesthesia have come up, similarly, many avenues to work upon. Specialization in one field, as one cannot be master of everyone. Suppose I joined a practice. I feel I love airway management, very good, field to work upon. So just keep on working on airway management. Being a practitioner, keep your daily practice as a routine. Plus, apart, you can work on the airway management. You keep on participating in the airway management workshop or webinars or seminars or conferences. The day will come, you will be recognized as one of the most potent faculty of that particular field. You have to choose that field particularly yourself. There are so many fields nowadays. The airway, the critical care, the monitoring part, any part, you research methodology and blogs and everything. You practice yourself, and I think you will be a force to reckon with the coming times. Again, that recognition, the dignity, the self-esteem, the Maslow's need hierarchy ladder, you will be climbing to the top spot. And ISA is the only common platform for us anesthesiologists where one can meet freely. It's a large platform. There are many small, societies coming up, but I'm talking about ISA. We can meet freely, can relax, and can feel the part of a big ISA family. This is a fact, but one has to take the initiative to join these platforms. So answer is clear. The reunion of academic and practitioners of that city branch and ISA has to go forward. And how to bridge the gap is the last slide. So regular attendance at city branch meets with a new unique case discussions or workshops or hands-on skills workshops. I think Nanded is doing well with the discussion of every weekly they are discussing a case. It is for every branch of the state and every branch of the country. active participation in other programs of ISA. There are so many programs being highlighted on the national part. ISA, art, culture, fit program, so many things are there. You can join any program, you will feel privileged, you will feel honored, you will feel motivated to work for the ISA activities. Reporting or writing the case when it is unique. Suppose you have handled a very unique case today. I think must have whosoever must be attending this webinar, one must have done or must have attended a very difficult case today. Start reporting it, start writing it. You can put ISA directory, or you can write about it. Send to a journal. Don't feel it's rejected or accepted. Just try to write. It will give you a sense of satisfaction, sense of some achievement. I am to this form, a formulation of academic committee at every city branch. This is my dream, that every city branch should have academic committee comprising of the academicians of the institution as well as practitioners who have a flair for the academics, because that academic committee can help you in publishing your case report. Because I think I may not be good in English language. I did a very good case, but how to write, how to go about it, publishing, I don't know the sources, I don't know the resources, how to go about it. I will contact my academic committee. See, I've done this case. This was the reason. This was the diagnosis. These were the steps taken to enhance the patient safety. This was a technique used. That take the help of that academic committee, and you will help in after getting the help, you will be able to publish that case or that report, and it will help you in gaining the self-confidence and make city branch so strong that every time a new member comes after passing out, he or she should feel that they are the newer members of the family. Make your city branch like a family. That's the first and foremost. In a family, nobody feels left out. I've listened to the stories of many stalwarts of yesteryears. I was in Aurangabad. I listened to Dr. Sadhana Kulkarni. How was the anesthesia at that time? How they really, went to make awareness about anesthesia. People were not knowing, general people, that anesthesia, are they doctors? Something like that. So what they did, they went to shop to conduct a seminar or a conference, so as to gather people, to make people aware. And they went to sweet shop, getting 1,000 rupees, something like that. They collected that money in organizing a conference to make people aware what anesthesiologists are. So they had a very tough time. Now we are already being held by a media. The social media is there. So those stories should be a motivational factor for us. How to go from here? It is not a single day process that attending this lecture will make you a good academician. It is the process, daily rigorous grinding. At least something should come out, motivate you to report a case, to write a case. I know you cannot do a research study, but writing a case, reporting a case, once it published in the international journal or national journal, it's highlighted there. It will give you immense satisfaction, and that day will be the happiness for you. Now, coming to the last, this one picture, this was a case of Charcot-Levin syndrome. You can see that, the spine is so much curved, the Cobb's angle disturbed, and whether this case should be handled by a practitioner or academician. I think anybody can handle this case, provided they have a sufficient knowledge about the pathophysiology of such cases. Because I did this case not in the academic institution, but in a private hospital. It was done because this was not my first case. This is a third or fourth case. But doing such cases, you should have a detailed knowledge. You should have something expertise in getting such cases done. Otherwise, we are compromising with the patient safety. So I will say, Jai IJ, that's my everyday dream. I'm breathing IJ, I'm sleeping, I'm eating IJ. Jai IJ, Jai ISN, and Jai.
Thank you, sir, a lot. I will thank you, Dr. Katikar Madam also. She is on present.
Good evening, ma'am. You are muted.
Good evening, sir. Good evening. Good evening, Sachin. Thanks for allowing me to enter the panel to part of the.
Previously it was Gmail, madam. Now I shifted to DigiShield. So
Yeah, I could listen everything. I could listen to your conversation, but I was not able to communicate. It was really nice, Dr. Bajwa, to listen to you, and we could find so many similarities because I think Nanded Anaesthesia branch is a private practicing branch, and many of the private practitioners have joined for today's session. And even I am doing private practice, doing single-handedly so many cases. So we could find so many similarities in your talk. And I must say that I must first congratulate Dr. Kotkar as well as Dr. Sachin for so many academic events. And really, Nanded is doing so well now in Maharashtra State Chapter ISA. And for your knowledge, Dr. Bajwa, they had organized an excellent conference a few years back, for 4 or 5 years back in Nanded. It was a great conference as far as academics was concerned. And Dr. Someshwar Paltange was the organizing secretary for that conference. And it was organized in an extremely nice way. And especially the academics was too good in that conference. And since then, Dr. Someshwar Patanjali, Dr. Rajesh Tagarpalli, Dr. Kotkar, Dr. Sachin, they are all doing good work in the as far as academics are concerned. And I think I am joining this fifth or sixth academic week of ISA Nanded, and I'm finding the speakers they are choosing, they are beyond that, at par beyond excellence. And what the topic for today, and who else will speak better than that? I think Dr. Bajwa is the greatest academician with having more than 400 publications, and he's a private practitioner. So many things to learn from him, so many things to learn from his talk. Thank you, Dr. Bajwa, for joining
Thank you.
the platform of ISN and
Thank you.
thank you, madam.
yeah.
There are questions, I think, in the chat box.
Yes, a question and answer.
Let me see the first from Dr. Jayashri Lad. There's sometime private practice doing NS, that is apply all protocols according to private practice in government setup, which will create problem, or rather we can say question mark on efficiency of that anesthetic working in government setup according to the facilities available over there, considering medical legal issues. Any solution to this? That's why this is a very good question. Actually, this situation occurs to many other people. You want to apply protocols, you become feel single-handedly attempting a very difficult case, and you want to go according to protocol, and sometimes may not be able to cope up with the limited resources and limited manpower. That's where come your clinical acumen. If you have experience in handling such cases earlier, you can always handle that case with those, even the limited manpower or resources. But I will say, if you have not seen those cases, there is no shame in referring those cases to the higher centers, because we are more working toward the patient safety here. When you are not, that's what I showed the slide here. That last slide means whether you can handle that in the practice or you can handle that in the institutions. When you are not sure, the voice will come from inside of your heart that this case I will not be able to do, so I am not going to do this case myself. It will not show that you are incompetent or something like that. It will show you are working more to the safety. And referring that case, saving one life by referring that case is a good thing. Now, solution to this thing, there is no particular solution. You may be called, yeah, this person is not competent. That is the one thing you will always be listening or hearing from somebody. But at the end, your own consciousness should say that you at least have not taken panga, or you have not taken, a unnecessary risk in getting that case done with the limited resources, where you may, or where you couldn't have been able to resuscitate that patient once the complications arises. So that is the answer to this question. But it is a never-ending discussion. There are many more situations also like that, and every situation is difficult in such circumstances, and solution to every situation is different, slightly different from each other. The next question is by Dr. Abhijit Nair. Is it possible that all district branches of ISA sponsor at least one private practitioner to attend a state national meet? This could be possible if there is a directive from national ISA or state chapter of ISA. Dr. Abhijit, first of all, I will say in practitioner, as a practitioner, you earn so much. Why you want a sponsorship? That's what the crux of the academic need. Why just one practitioner? I want that every practitioner of the branch should attend, provided their location do not get compromised in that particular city. So there should be a participation from the maximum, practitioner. Nowadays, you are talking about the sponsorship. I'm talking about myself. Being a GC member, I had to do the registration myself also. Attending a SAR conference, I have did the registration myself. Why to sponsor? When you are attending something, you always gain when you pay for something. And putting one practitioner sponsorship will, evoke a mixed responses among the fraternity. That why he or she is sponsored, why not others? So it's better that every practitioners or the academician they should attend, because the money, the how much money of the registration is 4,000, 5,000, 6,000, 10,000. This much money one can easily afford thrice or four times in a year to attend good conferences. So ISA sponsoring this thing, it will create something type of again a biased opinions among the fraternity. That is not feasible. But yeah, if the I have some ideas, I have got some vision for the best practitioner of that state or city to be represented in ISA national in a different way. That I don't want to disclose at the moment. The answer is there with me. I will be telling that in November only. I've got those plans with me also. So this is a good question. I will tell about that. Yeah, Dr. Sachin, any other question?
I think questions are over.
Or anybody wants to interact with any more?
Yes.
Chats are also there.
Yes. I'm checking.
Okay. There is chats maybe nahi hai kuch.
Nahi. From audience, anybody wants question?
They can attend directly and they can ask anything directly.
No, sir. They can only put questions in question box.
Okay, I will just tell one more thing.
Yeah.
That very soon, I started working upon the practitioners module. In 2016, I was one of the pioneer founder of that research methodology module for the academician. Deepen, okay, Deepen, I will see. On that, this one, 2016, we had this one research methodology workshop at Kolkata. That was the first workshop. And I was a pioneer in developing that research methodology module and got a president appreciation award for that. That's a secondary thing. But I am into this almost 50% into this developing the practitioners module. And for that, I will be launching that practitioner supplement in IJ also. And that is a part of the module. That module will go a long way in helping the practitioners to align themselves, to enroll themselves in the mainstream of IS. That I will come up very shortly. Presently, I'm very busy with many issues of the July issue, then the southern supplement of which will be released during SAR conference, then the August issue of the IJ. So many issues are on hand. So after that, the practitioner module is the foremost priority for me, and that will be very helpful throughout India for every practitioner. They don't have to look for the guidelines or protocols or something like that. That module will tell them how to handle each and every case.
Thank you, sir. Related to that credit points, we are trying for credit hours for this case meets. MMC will accredit us in future case meets, sir. And
I think that will enhance. I don't think the Maharashtra state they require credit hours for renewal. They ask for that.
Sir. Yes. MMC needed. No. Maharashtra state never asked for that.
But in Punjab state, you have to have 50 credit hours in 5 years.
Yes, Maharashtra, we have to complete 30 credit hours in 5 years.
Okay, 30 also, because in the COVID times, we have also reduced to 30 hours. But that is, I think, good enough. If we get 30 minutes for this CME, it's good enough. You will have so many hours. You don't have to
Yes,
go to the conferences also to get
yes,
sponsored.
yes.
Yeah.
So we are trying on that. We will get earliest as soon as.
That's great. That's great.
So, related to case meet, sir, this is our 26th case meet, and you are the faculty for 26th case meet. We completed 25th case meets
Great.
previously. So one of the great honor that you came on our platform on this evening for this case meet.
Thank you. I really congratulate the Nanded branch. They are doing excellent job, and this is what was required. This is a part of my slide also. What you are doing actually. This is required for the upliftment of the academics among the practitioners. This is something we should have to see feasible solution, the practical solution. At 8 o'clock, the timing is perfect.
Yes.
Majority of the time, the early morning they start doing a practice, and the night they're free when nothing is there. So this is the right time, I think. Majority of them can still glue to their
Yes. Yes, sir.
laptops or even the cell phones for this
Yes.
lectures. This is a good initiative. I really
Yes,
appreciate
sir.
it.
So we regularly do our case discussions in our ISA group, WhatsApp groups, or city branch groups. So anybody do any extra means special case or extraordinary case. So I tell them to present on this case meets. So everybody was really like to hear from her or him that what he did in that case. So we do regularly. Yes.
You keep sending me links every time. I will like to attend these type of case meets. I love to, because when I am going to formulate that practitioner module, everybody is not perfect. I may be having many limitations.
Yes.
I have to depend upon the feedback from the other people. Whatever the case is being discussed, in what way, what manner, and what complication, what scenario, everything has to be seen in a holistic attitude. So I just want to I want to attend these type of seminars and webinars. So you keep sending me links every time so that we can keep discussing. I can keep helping also the other people in academic point of view, not as
yes,
a
yes, yes, yeah, yes, definitely. Definitely, sir. Definitely. I keep almost all subjects in for private forums. Basically, I did LLM, LLB, criminology. So I keep medical legal cases also. I'm doing in CMT. So I keep for financial attitudes for doctors. Like so much of not only academic part, but I keep every objects of our private forums.
Yeah, great. That's great. I feel privileged to be part of this webinar today. I never knew that this type of things also exist in India. Nanded branch is doing good. I really congratulate the president and secretary as executive members. Keep doing this good work and keep involving me. I love to be part of this type of academic program. Especially the practitioners. I always want to be in the practitioner side. Maybe the professor and head in an institution doesn't matter, but the practitioners, this is the place where we have to come up. And just like 70% of the population stays in India in the rural areas, 31 urban areas. So you concentrate on the rural population to bring country to the development stage. So ISA needs development only when the practitioners will be the part of the mainstream. Without practitioner, ISA cannot advance further. Very slow growth.
Yes. Definitely, sir. I will send you link every time whenever these case meets are.
Sir, just to update you,
yes,
sorry
sir.
to interrupt you. Sir, just to
Yes,
add on this, what we do, sir, we have our digital platform in that we upload all the events which are happening across the India, which are done by through digital. So what we do, once we create the event in the platform, then we send a email. We do email campaign and notification to all our 50 to 60,000 doctors across the India. So email campaigns and event notification has been viewed by the delegates, and they can join according to their
branch and interest. Yes.
And also
Definitely.
the recorded video is also uploaded in our platform itself. Say once the event has been completed, event has been done, so their YouTube link and recording is been uploaded in our digital platform itself. So like if some delegate has not joined on the online, they can view the recorded session as well.
That's good. Dipen, I will be associating with you very soon regarding
yes,
Punjab and other areas also, and maybe the national also after some time. But I think DigiShield is a good partner. We are already partnering with ClearNet. So this is a good alternative for us also. And the better
Definitely,
things always do the comparison between the technology stalwarts. Whichever feels better is always given a impetus to go
yes,
forward.
yes, definitely, sir.
So Deepan, I will be in touch with you.
Yes, yes, definitely, sir.
You just
Thank
give
you,
me
sir.
a blank ring on my number,
Yes,
which
yes,
I'm
sure.
sharing with you,
Sure.
so I can save your number.
Yes.
We can go forward with it.
Yes, yes, yes. Thank you, sir.
And thank you, Dr. Sachin and Dr. Prahlad. This is a nice interactive session almost. So keep going. It's a great going, and keep the good work up. And we will be trying to meet at Nasik also. If you can come there, or Solapur, or wherever, Nagpur.
Whenever, sir. I will definitely, sir. Definitely. Thank you, sir. Thank you once again for this
Thank you.
lovely
Good night,
facilities.
everybody. Good night, everybody.
Good night,
Good
sir.
night, sir. Thank you.
Good night. Good night.
Good night.